So as chair, I will now recognize myself for 5 minutes. And I want to thank Chairwoman Eshoo for holding this hearing today. It's so important. In New Hampshire and rural states like Oklahoma, attending in-person treatment for substance use disorder can be a big challenge in and of itself due to our weather and geography and lack of access to transportation, work obligations, childcare, and all the rest. And that was before COVID-19. So when the coronavirus added yet another barrier to addiction and mental health treatment, our behavioral health providers transformed their delivery of care to ensure that they could continue to provide critical treatment while this country battles two epidemics, the opioid crisis and COVID-19. This was made possible by flexibilities during the pandemic, and I'm so grateful for this discussion to highlight these measures and provide a framework as we look ahead to expanding access to care through telehealth post-COVID-19. I've heard from treatment providers, addiction treatment providers, who emphasize how telehealth has in many ways resulted in greater appointment attendance, fewer cancellations, and more patients arriving on time. Dr. Mehrotra, you and your colleagues at RAND recently released a study examining transitioning to telemedicine for opioid use disorder treatment, outlining how buprenorphine prescribers quickly transitioned to provide telemedicine visits. Could you please describe how the current flexibilities around prescribing medication-assisted treatment has actually improved access to care?
Yeah, Representative Kuster, thank you for the question. And the study that we did was looking within the pandemic for treatment of opioid use disorder. And I think that's a real success story and a feel-good story that in the context of the pandemic, patients who were in treatment were able to use telemedicine to access care, stay on their medications, and get the appropriate care and not go back to, unfortunately, using opioids again. So that's a real success story from the work we've done. And through the Support Act, post the pandemic, that's going to be accessible to folks. I think there has been some frustration with the changes that have been asked for the Ryan-Haight Act to allow all providers to prescribe Suboxone and other medications for opioid use disorder and have that flexibility so it can be done via telemedicine. And I think that's a key area for us to provide that flexibility so we can provide that treatment in New Hampshire and the rest of the nation.
Well, I think it's so important. Now, you've mentioned that several of the participants were hesitant to see new patients, and that's concerning. What can be done to encourage greater uptake among providers who might be hesitant for using some of these new flexibilities, and especially for new patients?
No, I think we have been surveying and talking to a lot of opioid use disorder providers, and there's a wide variation in how comfortable they feel. One thing that we've called for is this is more not on the congressional side, but on the clinical side to create guidelines among the treatment community so that people feel more comfortable that this is a reasonable way to treat opioid use disorder. And I think that's going to be the key to convincing providers to move in that direction.
Okay, great, thank you. Thank you so much. I wanted to question you about flexibilities allowed for opioid use disorder treatment providers in providing telehealth across state lines. So New Hampshire is a small state with a lot of state lines, Vermont, Massachusetts, Maine, and I'd love to get your thoughts on delivering telehealth across state lines to some of our most vulnerable, including addiction and mental health patients.
Right. So in New Hampshire, we're very close by, obviously where I am, and it is difficult in many of those communities to find an opioid use disorder to get treatment, and providing that flexibility across the nation. And we do see a number of private companies that are providing very innovative new models to expand the use of telemedicine, and they can work across all 50 states so people can have that access. And as I articulated before, the keys to providing that in New Hampshire and the rest of the nation are licensure reform so that we can make that easier for those providers to do so, as well as I think all of you know, and is a really key aspect of this committee, which is broadband expansion. It's very frustrating in 2021 that so many Americans don't have access to that necessary technology.
Well, absolutely, and you've read my closing remarks, which are about exactly that. In places like northern New Hampshire, my district, Coos County, broadband is very limited in the western part of our state, and the successes of telehealth is only as great as the access to the digital infrastructure. And so lastly, I just want to submit for the record a recent report from Dartmouth Hitchcock on telehealth as a tool for rural health equity. And with that, I will yield back